Hello everyone. Today's topic of discussion is anatomy of heart. Cardiovascular system is personally one of my favorite topics in nursing, and I love to welcome all of you to yet another video of Nurse Talk. And it's me, Surya, registered nurse. So when we are talking about anatomy of heart, I think I'm going to do this video in two parts, part A and part B, because it can be a vast topic which I don't want to push everything into your brain at once. So I think we will divide the topic into two parts and do it twice. So it will be easier for you to remember or you to understand what I'm trying to say. Okay, so heart. Heart is a muscular organ, and the weight of heart is 300 gram, approximately 300 gram in males and 250 grams, approximately 250 grams in females. So we learned heart is a muscular organ. It's made up of muscles, and the weight of the heart is 300 grams in males and 250 grams in females. So here I have given an image of the heart. You can see it. So when we see an image of the heart, I want you to remember two important things when talking about the heart. First thing is, heart is not resting on its base. This thing what we have here looks like a base, but this is not the base of the heart. This is actually apex of the heart. Okay, and the base of the heart is here, the top. Remember, the apex of the heart is here, down here. It is made up of left ventricle, and the base of the heart is made up of left atrium. So whenever we say about something, for example, a mug or a bottle, we'll say this is the base. Yes, for everything we'll say this is the base and this is the top part. But for heart, it is not like that. The apex, heart rests on its apex. So the apex of the heart comes in the fifth intercostal area. Intercostal area means the space between the ribs of our chest. And the base of the heart comes in the second intercostal space. Intercostal space is the second intercostal space. So we all know the heart is in the mediastinum, that is middle of our chest, and it is actually levocardia. All our heart is levocardia. What is levocardia means? Remember, levo means to the left side. So our heart is in the mediastinum. Mediastinum means beside the sternum. Sternum is in our chest, like that is the chest portion, the middle of the in the middle of the two legs what we have on the right and left legs, and there is a mediastinum between the right and left legs, and heart is situated in the mediastinum, but it is just pushed a little bit towards the left side. So this is called levocardia. So you will ask me, what who has the heart on the right side? Of course, there are people who have heart on the right side, and that is a abnormality. Such people who have a heart cardiac system on the right side, it is called dextrocardia. So normally our heart is levocardia, that means it is lying on the left side of our chest, and heart rest on the apex, not on the base. Very, very important, because the top part of the heart is the base and the bottom part is apex. Apex is in the fifth intercostal space. It is apex, and base is in the second intercostal space. Okay, did you get an idea about the base and apex of the heart? So I'm saying it again and again because it can be confusing. Okay, and then we are going to the anatomy of the heart. The heart is covered with a layer. It is called pericardium. Pericardium, very, very easy to remember. Pericardium. So this pericardium has two layers. Already the heart is covered with pericardium, and pericardium has two layers. First one, the outer layer is a fibrous layer, and inner layer is a serous layer. So I am saying in detail about the pericardial layers at all, because you are going for, if you're going for a multi like MCQ for a question. For example, if you're going for a state or central government examination, they are not going to ask you where the right atria is or where the right ventricle is or who is getting the blood from all part of the body to right atria. They are going to ask you twisted questions, like difficult questions. So just remember to learn things in detail when you are talking about the heart. That's why I said I will take this class into two parts so that you can get detailed information. Okay, I want you to get detailed information so that you won't miss any questions coming from anatomy of heart. Okay, so the outer layer of the heart is a fibrous layer and the inner layer of the heart is a serous layer. See that there is an outer layer and an inner layer. So fibrous pericardium and serous pericardium. So between the fibrous layer, I'll draw it here again. Between there is a fibrous outer layer and here is a serous inner layer, and inside that is the heart. So between the fibrous layer and serous layer, there is a fluid. This is called pericardial fluid. Pericardial fluid. So what will be the function of the pericardial fluid? We all know that the heart beats. When the heart beats, what is happening to the heart is the contraction and relaxation of cardiac muscles. In order for the heart to contract and relax, there should be some space around it. Yes, of course, you all know that there should be some space for the heart to contract and relax. And this space is filled with the pericardial fluid. A question has been asked once for a state government examination. The question was, what is a normal volume of pericardial fluid? The normal volume of pericardial fluid is 5 to 20 ml. Okay, did we get the question from here? Normal volume of pericardial fluid is 5 to 20 ml. And this pericardial fluid, what will happen if there is an increase in the pericardial fluid? If there is an increase in this pericardial fluid, that is a disease condition called cardiac tamponade. Okay, so what all things did we learn today? This is anatomy of heart. We are talking about anatomy of heart. Two major points. Heart is resting on its apex. Apex is the fifth intercostal space, and the it is a left ventricle. Apex is the left. The most of part of the apex is made by left ventricle, and the base of the heart is the left atrium. This is on the top base, and it is in the second intercostal space. Weight of a heart in males are 300 grams and females is approximately 250. Okay, and then we learned about pericardium. Pericardial layer is a layer which covers the heart, but the pericardial itself has two layers, outer fibrous layer and inner serous layer. There is a fluid between the outer fibrous and inner serous layer. The name of the fluid is pericardial fluid. The normal amount of pericardial fluid in a healthy adult is 5 to 20 mils. Okay, did you get an idea of heart outside, like outside the heart? We are not yet going inside the heart, but we're just outside the heart. Okay, did you get an idea? Okay, so now you got what is pericardium, what is pericardial fluid is, and where is the heart resting in the apex, and what is base, and which intercostal space is the apex and base will be. Now we are going to say what is the total structure of the heart. Okay, so imagine you can see a picture of heart in here. It's a dissection image, and two colors are used in here. Two colors. One color is used here is blue, and the other one is red. You can see the blue in here and red in here. Why is it that? The blue color depicts, this blue color depicts deoxygenated blood, and the red is showing oxygenated blood. Okay, so deoxygenated and oxygenated blood. Actually, the blood is only one. We have red color blood. But to be honest, when we are particularly saying about the color of the blood in the arteries or oxygenated blood is bright red in color. That they are very bright in color, while the not here, here. Oxygenated blood is bright red in color, and deoxygenated blood is dark red in color. Okay, this is what the book says, dark red and bright red. sorry, but obviously we all know the color of the blood is red. But why is it given in two different colors? It is for our easy understanding to know that the blood flowing through this vessel and this vessel is deoxygenated, or the blood which lacks oxygen, or the blood which don't have any oxygen, no, which don't have much oxygen in that. Okay, so that is the two colors mentioning here. So I'm going to tell you what is happening here and what are these parts. There we can see lots of writings around the heart showing different parts. I'm going to tell you what these parts are. So see this one, superior vena cava and inferior vena cava. This superior vena cava, we can see the arrow coming this way. This superior vena cava and this inferior vena cava collects deoxygenated, that means the blood which lacks oxygen, to right atrium. This is right atrium. So what is the function of the right atrium? Right atrium collects deoxygenated blood from different parts of the body through superior vena cava and inferior vena cava. Once the blood reaches the right atrium, it stays there. It stays there because there is a valve in here. This is called tricuspid valve. How do I remember this? Is tri for right. Tri for right. Okay. The tricuspid valve is on the right side of the heart. This valve is closed and the blood is staying there. Once the valve opens, the blood flows down to the right ventricle. Okay. So superior and inferior vena cava collects deoxygenated blood and transfer it to right atrium. Right atrium, whenever the tricuspid valve on right side of the heart opens, the blood reaches the right ventricle. So we know this blood is deoxygenated. The blood doesn't have oxygen because it is coming, it is used. It is already, the blood that is coming to the right atrium has been already used by the body and it is coming without oxygen. So now the blood is in the right ventricle. Now the blood wants oxygen. So where is the oxygen? Oxygen is in the lungs because we are breathing and all the oxygen what we are receiving from the atmosphere is going to the lungs and it is collected in the lungs. The blood wants oxygen. The blood has reached the heart. Now it wants to go to the lungs to collect some oxygen and make it oxygenated. So what is happening here? From the right ventricle, there is a pulmonary artery. This is the pulmonary artery. Pulmonary means what? Pulmonary means lungs. That means a pulmonary artery is a road to going to lungs. So from the right ventricle, the blood go to the pulmonary artery this way and this way. See two branches here, to the right and left lungs. So this pulmonary artery carries deoxygenated blood to the lungs. So the blood got into lungs and now the blood is collecting the oxygen. Now the blood want to come back because they got oxygen and they are oxygenated now. So from the lungs they got the oxygen. So they are coming back through the pulmonary vein. Okay, see from the right and left side of the heart, we are having pulmonary veins to collect oxygenated blood from the lungs and they are getting it into the left atrium. Okay, so the oxygenated blood from the lungs reach the left atrium in here. Now they are staying in left atrium. We have a mitral valve in here. Mitral valve, it is also known as bicuspid. How am I remembering that? Left mitral, L and L. So left side is the mitral valve or bicuspid valve. So the bicuspid valve in here, whenever it opens, the oxygenated blood received from the lungs are flowing down to the left ventricle. Okay, and now the blood is in the left ventricle. So now they cannot stay there for long. The body needs oxygen, so the blood has to go. So when the contraction of the ventricle happens, the blood pushes itself upward like that. This is the aorta. Aorta is the largest artery in our, largest artery in our body is aorta. So from the left ventricle, the oxygenated blood pass through the aorta and it reaches different part of our body through aorta. Okay, did you get an idea of what's happening here? Okay, so inferior and superior vena cava collects deoxygenated blood from different parts of the body, and this blood reaches the right atrium. Once the tricuspid valve opens, I said once the tricuspid valve opens. So when is the tricuspid valve opening? We all know our heart beats lub dub, lub dub. Yeah, lub is the first sound and dub is the second sound. The first sound or lub is showing the opening of atrioventricular valves. Lub dub is the opening of atrioventricular valves. What are the atrioventricular valves? Atrioventricular valves are the valves between atria and ventricle. Atria and ventricle. So when the lub sound goes, when we are listening to the heart rate, the stethoscope, we can hear lub dub, lub dub. So the first heart sound, lub, this has been asked in couple of times in different examination. So what is the first heart sound means? The first heart sound means it is the opening of atrioventricular valves. So the first heart sound, this top part of the heart contracts. This valves opens, both the valves opens, blood flow from the atria to the ventricle, not just right atria, even the left atria. Okay, so the lub sound or the first heart sound is a sound where atrioventricular valves opens, and that pushes the blood down to the ventricle from the atria. So now we got what is the lub sound. Atrioventricular valves or tricuspid valve and mitral valve are the atrioventricular. Atrioventricular means tricuspid and mitral valve. Those valves are opening. That means the arteries are contracting, letting the blood go down to the ventricle. So now the blood is in the ventricle. Now comes the second heart sound or dub heart sound. During the dub heart sound, which valves are opening? In the dub heart sound, there are also two valves opening. First one is pulmonary valve, letting the blood go through the pulmonary artery, and aortic valve, letting the blood go to the aorta. Okay, so when this dub sound means contraction of the ventricle and relaxation of the atria. When they contract, this valves close, tricuspid and mitral valve close. Sorry, this is all messed up, so just going to erase it. Yeah. Okay. So the second heart sound, where the ventricles contract. When the ventricles contract, this tricuspid and mitral valve close, because otherwise this blood will go back to the atria. So we don't want the blood to go back to the atria because they had enough suffering to push it down. So we don't want them to go back. Instead of these valves, these two valves will open, 1 and 2. Which valves? Pulmonary valve and aortic valve. See, aortic valve and pulmonary valve will open. So first heart sound is atrioventricular valves opening. Second heart sound is aortic and pulmonary valve opening. When this aortic and pulmonary valve opens, this both the ventricles contract and the blood wants to go somewhere because there is no space. The ventricles are contracting. So they cannot go this way because this is already closed, cannot go back. So they can only go through this way. So from the right ventricle, the blood reaches the pulmonary artery and thereby to the lungs. And when the left ventricle contracts, the blood goes through the aorta. Okay, so this is what is happening during a heartbeat. So the first heartbeat, atrioventricular valves open, pushes the blood down to the ventricle. Second heartbeat, the pulmonary and aortic valve opens, pushes the blood. This one pushes the blood to the lungs, and this one pushes the blood to the different parts of the body. I was already saying that aorta is one of the largest, not one of the, aorta is the largest artery of human body. So to push the blood through this valve require a lot of pressure, because from the right ventricle, the blood is only going, oh goodness sake, sorry. From the right ventricle, the blood is only going through to the lungs. Lungs are the nearby neighborhood, heart's neighbors. Lungs are heart's neighbors. So for right ventricle, it is not a big job to push the blood to the lungs in here and lungs in here. Meanwhile, imagine the pressure of left ventricle, because the left ventricle is trying to push the blood out through the aorta. The responsibility of aorta is to give blood every part of the body, including the head to the toe. Okay, so remember, the inside the heart, the highest pressure is inside the left ventricle, because it is responsibility of the left ventricle to push the blood out to the aorta, and it is also responsible to provide blood to different parts of the body. So left ventricle's pressure is very high, and also it is the most thickest. It has the most thick muscles. See the muscles in here, they are the most. Left ventricle has the thickest walls, because that much pressure they are inserting towards the blood. So we got few questions in here. Largest artery in the body, aorta, and which mm, part of the heart has the highest pressure, left ventricle, and which part of the heart has the highest muscle, like muscle layers, that is also the left ventricle, because they need it for providing the blood. So now we have learned an overview. Another important question that can be asked, but it is a very easy question but still can be asked in different examinations, is the pulmonary artery and pulmonary vein. In our body, I already said we have two types of blood, oxygenated and deoxygenated. Oxygenated and deoxygenated. Normally, oxygenated blood is carried by arteries, and deoxygenated blood is carried by veins. If you remember during our class regarding the intracranial hemorrhage, I was saying you arteries carries oxygenated blood and it goes in a very high pressure, because that blood is coming from aorta. If you remember, if you haven't watched that video, you can go back and watch. When I was talking about the intracranial hemorrhage or epidural hematoma for a patient, I said arterial bleeding is very powerful, and the patient's condition will very rapidly worsen if a patient has got an arterial bleeding, because the pressure is very high. That means the blood coming through the arteries are coming directly from the heart. So it is very high pressured, and it is oxygenated. In our body, normally this arteries carries oxygenated blood. All the arteries in our body carry oxygenated blood, and all the veins in our body carry deoxygenated blood, except pulmonary artery. So remember, pulmonary artery is the only artery that carries deoxygenated blood. Very important. Why is it important? It is important because it is an exception. Exceptions are always important. Pulmonary artery is the only artery that carry deoxygenated blood, and pulmonary vein is the only vein that carry oxygenated blood. Okay, pulmonary artery carry deoxygenated blood from the heart to the lungs, and pulmonary vein carry oxygenated blood from the lungs back to the heart. So very important to remember, pulmonary artery and pulmonary vein is an exception when we are talking about any other veins and arteries of the heart. Did you get an idea? Okay, that's all today's card. I'm going to continue this class with another part B, because there is a whole lot more things to say while coming to them, especially to the examinations like NCLEX or MCQ government examinations. There are a whole lot to say. So I'm going to just stop the video in here, because I don't want to push too much stuff in your brain and making it more confused. I don't want to do that. So today's session, we were learning about the anatomy of heart. We said about the weight of the heart differs 300 gram approximately for males and 250 for females. And then we were saying about the apex of the heart. Heart is not lying on its base. It is lying on its apex. Very important. And the base of the heart is here. It is in the second intercostal space, and apex is in the fifth intercostal space. Okay, and then we were saying about the pericardium. The pericardium has two layers, outer fibrous layer and inner serous layer. The space between the in between the space of the outer fibrous and inner serous layer, there is a pericardial fluid. Normal amount of pericardial fluid in a healthy adult is 50 to 20 ml. If there is any increase in this pericardial fluid, that is a disease condition called cardiac tamponade. When we discuss about the disease condition, we will have a discussion on cardiac tamponade. Now we are only going to say about the anatomy of the heart. Okay, so that is pericardium and pericardial fluid normal value. Then we learned, then we were talking about the anatomy of the heart, where superior and inferior vena cava collect deoxygenated blood, leaves it in the right atrium. So this right, okay, never forget in your life, right side of the heart has tricuspid valve, left side of the heart has mitral valve, also known as bicuspid. Okay, never forget in your life, right side of the heart is tricuspid valve, left side of the heart is mitral or bicuspid valve. So the blood reaches in the right atrium. When the heart contracts during the first heart sound lub, atrioventricular valves opens and let the blood flow from the right atrium to the right ventricle, and from the right ventricle the second heart sound, dub heart sound, aortic and pulmonary and aortic valve opens, and the blood goes from the right ventricle to the lungs through the pulmonary artery. Very, very important. Pulmonary artery carry deoxygenated blood from the right ventricle to the lungs. And once the lungs get oxygenated, once the blood get oxygenated from the lungs, it is coming back through pulmonary vein to the right atrium, opens the mitral valve or bicuspid valves, reaches the left ventricle. Left ventricle is the most important part of our heart, which helps us to push the blood all over the body through aorta. The aorta carries blood to give it to every single capillaries of our body. So the pressure in the left ventricle is very high, and the left ventricle has the thickest muscle in the heart. Okay, I hope you got an idea. And also the exceptions. Pulmonary artery is the only artery that carry deoxygenated blood, and pulmonary vein is the only vein that carry oxygenated blood in our body. So I hope you got an idea about what I am trying to say in cardiac anatomy. And next sessions in the part B, we will learn about. So we are learning about the heart is pumping the blood to different parts of the body. Yes, the heart is. It is a responsibility of heart to pump different to blood to different parts of the body. And who is giving blood to the heart? How is the heart getting any blood? We need to know that also. Okay, our mummy cooks food for everyone in the house, and does anybody go and ask the mummy, did you have any food? Did you eat anything today? Yes, it is our responsibility to ask her to, did she had anything today, or did she had a drink, or does she want to go outside for a walk? Yes, so just remember, in the next video, we are going to discuss about uh, like the blood supply to the heart, and also there are small valves in the heart which can be very, very important for your MCQs. So all those tiny structures around the hearts, and also some functions of the heart, what they are doing, or in detail about some functions of the heart. Okay, I hope you got an idea in today's class about what I am trying to say. In case if you have any doubts, you can pop it in the comments and I can come back to you. And also otherwise, if you have any particular topics to discuss before your university exams or before your upcoming competitive exams, just pop it in the comments and I can do that video. Okay, hope you are all doing good, and thanks for watching my video. Bye bye, take care.